Janell Hogan is a Master of Social Work. She is the social worker at the University of South Florida Department of Neurology. She has worked with the Huntington's disease community, providing therapeutic intervention, care management, and assessments to patients and families impacted by HD. Currently, she's active in research HD studies. Her professional experience includes family therapy, home-based interventions and support, development screening, children's mental health, and crisis intervention. She also has served as a patient advocate, assisting patients in obtaining Social Security disability benefits, state and local benefits and resources. We know these are so important to our families because once a Huntington diagnosis comes, one of our best friends is our social worker.
It's hard to do this without fogging my glasses too much. But typically what I try to do at events like this is try to assess what the needs are of who is actually at the event, as far as talking about resources and things like that. And so I put on some tables this document that we'll be talking about later on. I have more copies if we need more copies, but this is one of the state resources that we have and that we use regularly with HD. And so I'll be talking about that a little bit later on as far as long-term care assistance through the state of Florida, and when to start talking about that and thinking about it. One of my goals for 2022 is to really start having these conversations with our patients that we see in clinic and in the HD community in general sooner as opposed to later. Because I think it's just important, along with Social Security, that we also think about what the in-home needs are as Huntington's progresses, and what care supports you have and what you will need in the future. That's what that thing is. And if anybody needs one, let me know and I'll get you one. So my clicker. So I'm Janell. One of the first things that I like to talk about when we start talking about systems navigations, just in general, but especially when you're living with a neurodegenerative disease, is making sure that you take care of yourself through this process, because it's very overwhelming and anxiety provoking. And it's very frustrating because there's often a disconnect between kind of the system at large and what your needs are. And so the big picture with that is being able to understand the system and how to navigate that with HD to get them to understand what your needs are. Because a lot of times it seems very simple. Okay, I'm disabled, I can't work, or I can't care for myself, or my loved one is struggling during the day while I'm at work and they need some support. Let's just get it in there. Unfortunately, the system doesn't look at it that way. And we have a hard time painting the picture for the system of exactly what our needs are. And so being as specific as possible and doing those things can be hard when you're tired, when you are still especially trying to work and you're having to do the emotional work involved in maybe accepting the fact that work is becoming more and more difficult, and maybe it's time to apply for disability. So these are all things that I look at and I talk about when we talk about applying for disability, applying for other benefits that you may be eligible for. It's not as clear cut as one might assume of, okay, let's apply for disability. Let's just do that and check it off the list. There's a lot more involved in it. And the more that you are aware of the importance of documenting things accurately and painting that picture to Social Security, to state long-term Medicaid programs or local county programs, the more likely you are to be approved and get those services started immediately. That is just things that I like to talk about up front so we can weave those into the conversations when we start talking about actually applying for the disability process. When, as a lot of you guys know, for Social Security, there is the compassionate allowance. for disability. And so when people hear that, they hear, oh, I have Huntington's disease, I'm automatically going to get Social Security disability benefits because I'm going to apply under compassionate allowance. Unfortunately, that is not true. Unfortunately, in our current labor market, that is even less true. So one of the things that we have seen during the pandemic is a significant increase, especially in the state of Florida, and the number of denials for Social Security benefits. And since September of 2020, I've only had one patient get approved for disability on their first try. That was after going about 4 years of all but one patient getting approved for disability every time on the first try. And so things that kind of influence that as far as Social Security at the systems level up here is the job market. So in order for Social Security to deem you disabled, you have to prove to Social Security that you're unable to do any job in the labor market. And how they look at that and what they determine that is individual on different levels. One is your age. So if you're over 55, between 55 and 65, Social Security will say, okay, you're 55 to 65, you're less likely to be retrained. Your job training score, your ability to do that is lower. So you can pretty much guarantee that Social Security is going to not expect you to be retrained, and your chances of getting approved are higher because of that. However, it's still, you have to show that you're not capable of doing any job in the labor market. And because we have such a labor shortage in the country right now, they can pretty much use that as an automatic denial for a lot of people. They'll go through all the steps, but they'll say, hey, Walmart is hiring greeters again. Can you be a greeter? And so I use the Walmart greeter example very specifically because that seems like a very easy job. But for somebody who has frontal lobe deficits, greeting people in a nice way for 4 hours all day, every day, might become challenging because they're going to become agitated or frustrated. So it's important when you're applying for Social Security disability that you paint that picture. So think about the easiest job in the labor market that's going to be most available, and make sure you're painting a picture to Social Security as to why you can't do that job. So going back to the Walmart greeter example, you would say only able to interact with other people for short amount of times, needs frequent breaks, unable to read and interpret social cues or understand other people's body language. So if somebody else is angry, somebody with HD might have a harder time processing that person is angry or upset. And so you being a greeter at Walmart is not something that that person's going to be able to do. And so we all in this room know that's something that happens with HD. Social Security doesn't know that. And that's what you have to show Social Security. You have to paint that picture very vivid. And right now you have to do it a lot more detail oriented than we did, unfortunately, 2.5 years ago. We went over the compassionate allowance. Sorry, I didn't progress my slides. Struggling a little bit to see because of my glasses. But so this goes back to the Social Security compassionate allowance, what it is and what it isn't for Huntington's disease. And it's important when you are applying for Social Security that you do state that you're applying under the compassionate allowance, but not for Huntington's disease. And I know that sounds very silly, right? Like, why is it important to distinguish Huntington's disease versus adult onset or juvenile onset Huntington's disease? And literally it's about the alphabet and how they file it. When you go on Social Security's website, if you look up compassionate allowance for Huntington's disease, guess what you're not going to find on their alphabetical listing? You're not going to find under H, Huntington's disease. Under A, you will find adult onset Huntington's disease, and under J, you will find juvenile onset Huntington's disease. But under H, you're not going to see Huntington's disease. So the initial reviewer who sees your thing that says, okay, I have Huntington's disease, and they're going to check and see if there's a compassionate allowance, they're going to go to H for Huntington's disease. And they're going to be like, okay, there's no compassionate allowance for that. So it goes through a different determination process. And that's when they look at you in the same category as they look at somebody who's applying for disability because maybe they've been a laborer for 20 years and they have chronic back issues. And I'm not minimizing people who have that issue because they've been working for 20 years. I'm just saying you don't want your application to be put in the same pile as somebody who has chronic back issues for consideration. So that's why it's important to do that and to make sure that you're documenting that correctly. A big part of what all applications for any type of assistance, although Social Security is not assistance, it is accessing benefits that you have earned through work. But anytime that you are applying for any type of benefit or asking for any type of assistance in your home, you want to focus on activities of daily living. And that is why that is so important, is because a lot of times there's underreporting of what is happening with on a daily basis and how much assistance somebody actually needs when their activities of daily living. And I will give you an example. Okay, a lot of times people will say that they don't need help with dressing. However, this person no longer wears button-down shirts. They, as part of their job that they've had for 20 years, they wore button-down shirts. So in order to do your job at the post office, we just use that as an example, you have to wear a button-down shirt. And so you don't think you need help with getting dressed because you've just had somebody else help you button your shirt, or you've come up with your own thing where you make your shirt, you buy a little bigger shirt and you make it a pullover shirt because you keep them buttoned. People do those things. I'm using that as a specific example. If you've made any type of adjustment in how you dress yourself, you need assistance with activities of daily living that involve dressing and grooming yourself. Okay. If you don't brush your hair, a certain part of your hair, you can pretty much manage it to get out of the house, but you can't fully comb through your hair because your chorea or because of any of your movement or motor deficits, you need help with activities of daily living because you've made a modification, and caregivers and loved ones automatically make these adjustments all the time that they don't even think about them. So it's very important when you're filling out any type of thing that requires really assessing, needing assistance with activities of daily living, that you are asking yourself, what modifications have I already made automatically? Another big thing is cooking. People will stop doing stovetop cooking. Why do people with HD stop cooking on the stove? Anybody want to? Multitasking, exactly. When you're cooking on the stovetop, it requires a higher level of multitasking than putting something in the oven and setting a timer and taking it out of the oven when it's done. So can you cook for yourself if you have stopped doing stovetop cooking and only cook things in the oven? No, the right answer is no, you can't. In reality, on a practical, everyday, how you're doing level, yes, you can cook for yourself. But for Social Security, can you cook for yourself? No. For Medicaid long-term care, can you cook for yourself? No, you need help because you've made a modification to how you do that skill. And now if you've always been the person that's always baked because you've never been able to cook on the stove top, that's different. So then your level of assessment of modification is when you only start cooking things in the microwave. So think about those natural modifications that you make every day just because it's a survival skill. We all do it. Don't take that for granted in your application. Another thing that people tend to underreport in regards to activities of daily living is, can you do this? And I always use the example, I'm going to think of a new example because I'm tired of this one, but for today, I'm going to use the same one I always use, which is, can you hold a gallon of milk? Who here can hold a gallon of milk? I would say probably 99% of the can hold a gallon of milk. Can you hold a gallon of milk for 20 minutes? I would say probably 5% of people in this room can hold a gallon of milk for 20 minutes. And so that's what it's about. It's about your ability to maintain pace. And that is, okay, I can't see what slide I'm on. Somebody want to help me out? Okay, it's activities of daily living continued. Okay. All right. And so maintaining pace is very important with Social Security. And so a lot of times when you're filling out questionnaires, it'll ask you, can you do this? And a lot of times people will say, yes, I'm able to do this. Are you able to bend and stoop? Can you bend down? Yes. Most people, even through the almost towards the end stages, can bend down that have HD. However, can you bend and stoop 8 hours a day with two, like, labor law mandates of you get 2 15-minute breaks and a 30-minute break? Do you need more rest? And that's where a lot of times somebody who has HD is going to not have awareness. And it's not just somebody with HD that doesn't have awareness. A lot of times our self-reporting for all of our things, for everybody, is not necessarily fully accurate. You want, as a support person to somebody who's going through the application process, you want to make sure that you're painting that picture for them. Okay, an example is in the kitchen. For example, somebody used to be able to complete all the steps to making their own breakfast, okay? Meaning they were able to go get a bowl, get a spoon, pour their milk, pour their cereal, pour their milk, eat their cereal, then put their bowl and their utensils away, put the milk away, put the cereal away. Now, I'm fairly certain that most of y'all have people in your lives that don't do that, like I do, because I have children. But if this is a person that used to do those things, they used to be able to fix herself a bowl of cereal and put the milk away, put the cereal away. And now, yes, they're able to still make themselves cereal, but they're pouring milk. They're pouring cereal on the counter. They're forgetting to put the milk away in their refrigerator. That's a picture that you're painting to Social Security that's telling what they're unable to do. So using a narrative to describe, say, Susie used to be able to make multiple phone calls a day to help schedule her appointments and schedule her children's appointments. Now I see her struggle with just making one phone call, and then she forgets. Using the word forget, when you see forgetfulness with cognition, is important. Now she will forget to confirm if I'm at the dental exam, they're doing a cleaning. And so she has to call back. And then she forgets that she's confirming the dental cleaning for her second child. And so those are things that as observers from somebody who's applying for Social Security that you can write if somebody tends to be lacking a lot of personal insight as to specifically what their issues are. As far as the compassionate allowance for Huntington's disease, I want to go back and just mention that the criteria for Huntington's disease includes cognitive impairment and psychological impairment. But meeting that criteria is not done under Huntington's disease. It's done under a different part of the Social Security requirements for disability. And so you have to prove that. If you are somebody whose primary presentation is cognitive impairment, I really recommend connecting with a social worker whose expert is in Huntington's disease or neurocognitive disorders, because it can be very tricky with Huntington's disease to document those cognitive changes and apply them in a vocational way. So one of the things that I do, or I have done to show that decline in cognition, is we have patients, don't mean to plug a study, but I'm going to plug a study. So we have patients that are involved in the Enroll HD study. And so every year they come, and they often come before they're symptomatic and they're still working and they're still functioning on that level. And then we do assessments on them. We do different types of cognitive assessments. And so we have that data on them from years of coming, say 3 or 4 years of coming for that. And then we're able to see where the decline is. And so we can capture that by I do a report based on that data that we see to track it. That's one way to do tracking progression, which Social Security likes to see. And with cognition, with cognitive changes. Now, when you have somebody who is unaware of their cognitive changes and work is making accommodations for that, it can be difficult, because ultimately, a lot of times what happens in that situation is the person ends up losing their job. We don't want that, because it's going to exasperate the person's denial, and increase irritability and things like that. So being able to document somebody's cognitive decline that you see, making note of it. If you are living with somebody who has HD and is still working, taking note of those cognitive changes is important, because Social Security is going to look at your report of saying, I noticed 2 years ago they could do this, they were able to do this, the same way that they look at our report from a professional at documenting all that data. So your information as a caregiver to Social Security is just as relevant as our documentation. So I'm going to say that again. If you are living with somebody who has HD that has cognition as their presenting symptom, and it's causing problems with them at work, start documenting those things, because you can say that in your report in Social Security when the person files for Social Security. They always ask, who is somebody that knows about your condition? And that's where they ask that question for a reason, because Social Security doesn't necessarily want to deny you. They want to follow the law. That's what they do. They work based on laws. That's why attorneys are often involved in the Social Security determination process, in the Social Security application process, because it's all based on law. So that information is very valuable. Don't think I'm just the husband, I'm just the wife, I'm just the daughter, I'm just the son. Don't think that what your observations are of that person's changes in their cognition, their behavior, their motor symptoms even are not important, and they're not going to listen, because they're going to probably listen to you just the same, if not, depending on level of documentation of the person's symptoms, more than they will the professional documentation. For psychological impairment, for people who present predominantly with psychiatric components, you go under the criteria for psychiatric disability. It's harder to get disability when your primary presenting symptom is psychiatric, but it can happen. It's very important, if somebody's first presenting symptom is psychiatric, that person sees a psychiatrist. The reason why is the psychiatrist is going to document things under the same capacity in which they're evaluating it at the Social Security level. So when they're looking at records for somebody, you're saying, okay, you can't work because you have Huntington's disease and you have mood changes, and the symptoms that you have of Huntington's disease that prevent you from working are mood changes, major depression, and major anxiety, all of those psychiatric symptoms. They're going to want documentation from a psychiatrist, because how that's evaluated and reviewed is different than a neurological report. So again, if somebody's primary symptom is psychiatric, you're seeing your HD specialist. Our center, we have a psychiatrist that works with us that's HD informed. Other centers have one of their primary physicians or is a psychiatrist in their center even. You need to see a psychiatrist. You need documentation from a psychiatrist. It's very important, because that's what they're going to want. They're going to want functional capacity in a mental health way, and not in an HD documented way. Talked about a little bit about barriers already. It's not clicking forward. Help. No, next. Yes, that are beyond our control. Thank you. I appreciate that. So we talked about these a little bit. I talked about these from the beginning, but I'm just going to go over them a little bit. Social Security looks at people that are under the age of 50 differently, because they assume that people can be vocationally trained for an available job in the labor market. And if you are under 50 and you are applying for disability for Huntington's disease, it is it's just so critical that you, like when you're filling out the forms, that you paint that picture of what I said earlier with the example from Walmart. Think of all of those things and make sure you're showing them all of the ways in which your symptoms translate in your inability to work any job. Over 50, there's more leniency, but under 50, it's very important that you do that. The other thing is that the more education that you have, Social Security assumes that you have more opportunities for employment and skills that can translate into substantial gainful activity. So substantial gainful activity right now is $1,300 a month. So if you can work even part-time and earn more than $1,300 a month, then Social Security is going to say you're not disabled because you're capable of working in our labor market, earning more than $1,300 a month. So I'm going to do a social justice plug here and a social advocacy thing. When we have really great ideas for social change, to change minimum wage to $15 an hour. These are things that we don't think about. We don't think about, we also need to change that $1,300 a month. Because now people can't, they're gonna say, I think Target's hiring at $20 an hour right now in some places, okay? So making that $1,300 a month right now is gonna require less work for somebody who doesn't have higher level of education than it did 2 years ago. So two plugs there. One is that when we do things to change one system, we have to think about the impact on other systems. And I'm not saying don't make the change. I'm just saying we need to tell Social Security that they need to change their substantial gainful activity amount to reflect the national economy. And then two is that people who are getting denied, that's the reason why, because now they can work less hours and that maintaining pace is less relevant, because now you can work 3 hours a day and earn $60 a day. And you can do that 7 days a week, because guess what? People are closing their doors because they don't have workers. And so it's very important that we do two things with this information, that we understand that amount of money is not what it was 2 years ago, and how that impacts determinations for Social Security at the time. Okay, so how's my time? Okay, perfect. Okay, so the map of Florida that I put on the table. Okay, that's what this is about. This is the long-term Medicaid benefits. So many times in clinic, I go to talk to people about this and they hear the word Medicaid and they go, I don't qualify for Medicaid, I've already applied. It's not the same Medicaid. This program is different. I have people who get this program that have income of more than $5,000 a month. Okay. It's not the same as Medicaid insurance that pays for your medical expenses. It's different. Why does this program exist in the state of Florida and across the country? Because this is a program that provides what they used to call waiver services. I think across the board, across the country, they're using different words now, but it depends on what state you're in. But whatever state it is would rather pay $2,000 a month for you to get in-home care and support than pay $8,000 for you to be in a nursing home. So of course, the moment that we say the word nursing home, that's a trigger word in the HD community. And so somebody says, I'm not putting my person in a nursing home. I'm not saying we're putting that person in a nursing home. I'm saying that in order for you to get care in your home, we have to paint the picture to the state of Florida. I'm speaking about the state of Florida because I know that obviously the most, that you need nursing home level of care, and that you're waiting that service in order to receive that care in your home with your family support. Okay, and this goes hand in hand with timing and being realistic and understanding and anticipating what your needs are today may not be what your needs are tomorrow or 2 years from now. There is always a wait list for this program. So I've really restructured my thinking about this program. And when I start talking to people about this program is more and more when they're in the middle of stage 1 is really when you need to start looking at this program, the financial component of this. There's a in the state of Florida, there is a spousal impoverishment law that protects spouse's assets. So if you are married and you are still working, you're still contributing to a 401k, you have some assets that you're like, I'm not going to qualify for that because I have a 401k. Yes, you will. As somebody who is married, when somebody is married to somebody who has HD, you want to make sure that your assets are tied to retirement. Doesn't necessarily have to be a 401k. So if you have some cash assets out there, it doesn't matter. Put them in a Roth IRA, tie it to retirement. The reason why is that doesn't count. That income, if you're working and you're contributing to a 401k, say you're putting 10% of your income into a 401k, that 10% that you're contributing to your 401k doesn't count as your income for this program. So there's a lot of loopholes for this program that people qualify for, and they just automatically hear nursing home and they hear Medicaid and they think they don't qualify. So I encourage you to really look, if you live in the state of Florida, reach out to your area agency on aging in your area, call them and ask about their Medicaid long-term care program. Now, one of the qualifications for this that you do have to have in order to get it is you do have to have a disability status. That becomes problematic especially for women who are married and did not pay into Social Security because they were staying at home and raising children. And then, so they don't qualify for SSI, supplemental security income through Social Security, and they didn't have enough work orders to receive their own benefit. There's a way around that. When you call and you find out about this, they'll ask you, are you disabled? Or is the person that you're calling about disabled? And so what they want is that disability status per Social Security rules. If you are looking for in-home care support with that, and you don't have a Social Security benefit, it's very complicated. You need to speak to a social worker because you're going through the normal systems navigation on that. You're not going to qualify. However, if you need nursing home care, you can ask Social Security to make a disability determination on you without a financial benefit. And they will do it only for purposes of skilled nursing care placement. I like to just make sure that everybody's aware that you do have to have a disability status in order to qualify for the Medicaid long-term care program in the state of Florida. Other states are very similar as well for that, because this is a federal program that's matched with state funds.